Okay, so cardiopulmonary resuscitation is also known as CPR, and CPR saves up to 75% of lives when it is performed correctly. So I'm here to teach you some about it today. So before giving CPR, there's 5 main steps that you're going to use to make sure that the scene is safe. So first, you're going to pull up and make sure the scene is safe. So if you see any smoke coming out of a room or see sharp metals or objects on the ground, you're not going to go help them. And then second is you're going to call 911, or you're going to have someone else call 911 once you know that the scene is safe. And then after calling 911, you're going to come up to the person, and then you're going to tilt their head back and have your fingers on their neck and put your ear down and try to listen for pulse and breathing. And then once those are, if you can feel pulse but there's no breathing, then you're going to start with your breath. If you can feel no pulse and no breathing, then that's when you're going to start with your CPR compressions. So, next one. Okay, so there's a whole bunch of ratios for adults and children, and they change almost every year, so it's a little hard to keep up. But the main importance is if you do your compressions hard enough, then you're going to get air into the airway, so then breathing is not going to be as important. So when you're going to push down on the chest, you're going to push down at least 2 inches. And that 2 inches, when you're doing it, if you're doing it right, you're going to break the ribs, and you'll feel it when you break it. But if you're not breaking ribs, then you're not doing it hard enough. So you'll be able to know that. And you should do about 100 reps a second or a minute. So you know the song Staying Alive? That's just what they teach us, like, staying alive. That song. Okay. So for adult, child, and infant, the ratio is 30-2, so that's 30 compressions and 2 breaths. If you put a breath in and you do not see the chest rise, then you're supposed to lean the head backwards and then do a breath again until you see the chest rise. And then when you're doing 2 responder CPR, so that would be like me and Katie, then your ratios are going to be the same until you get to an infant. The infant has a much smaller body, so it's a lot easier to break. So then you don't have as much surface area that you need to worry about, so it cuts it down in half to 15-2. So, ready? You're going to do it. Okay, so the first step is make sure the scene's safe. So what are you going to do?
I'm going to look around and see if there's smoke or if there's any sharp objects.
Okay, so now I'm going to call 911 for you because you told me to call 911. Okay, now second, you're going to check for a pulse and tilt their head back to see if they're breathing. Okay, they don't have a pulse and they're not breathing. So what are you going to do? You're going to start compressions. Okay, so you're going to put your fingers right in the middle of his chest right here. You're going to put one hand on top of the other, like that, and move it up a little bit. Then you're going to press down till you hear a click. It's going to be hard because you're on the table. Yep. So then you're going to do 30 of them. Go. A little faster. So, yep. Okay, it is a little harder because you're on a table, but majority of the time you're going to be on the ground when you're doing this, but keep going. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now you're going to tilt the head back and give another breath. Wait, this is a mask that you can use, and if you don't have one, if you don't have a mask and you're not comfortable with like mouth to mouth, then just compressions are basically all that you will need. But if you have a mask, like I'm a lifeguard, so I just have this stuff, but normal people won't. But you can just put the mask on, and then you're gonna tilt the head back and then do 2 breaths. You don't have to actually just say breath.
Breath.
Okay, so now you're gonna check their pulse and see if they're breathing.
Looks like they're breathing.
Good, you did a good job. Okay, so wait, we're not done. Okay, so now we got this little baby, and we're gonna do it on the baby. So, since the baby has a smaller diaphragm, you're gonna use 2 fingers, or you're gonna use both your thumbs, whatever you feel comfortable with. And it's the same ratio as 30-2 for all the other, because you're just gonna do it by yourself, and then next we'll do it together. Okay, so you're gonna do the same thing.
Check.
Yeah, you're gonna hear air come out of his mouth. Yep. So breathe. He's not breathing, and doesn't have a heart rate. 2, gotcha. half an inch. Half an inch. Yep. And you're going to press down, not 2 inches like an adult, but you're going to press down to half an inch to an inch.
Breath.
Yep. Okay. Okay, so now we're going to show you what it looks like to do two-person CPR. So on an infant, it's going to be cut in half, so you're only going to do 15 compressions and 2 breaths. So when you're doing it two-person, you're going to have it like this, and you're going to do compressions, and I'm going to do breaths.
Okay.
Okay. Then I'm going to go breath, and check. And then you're going to start over. And then it's basically the same for an adult. You're going to do compressions, and I would do breaths. And that is basically all CPR. You can keep doing CPR until you feel that you are too tired to continue, because you're not supposed to risk your own well-being for a person. And there's this law called the Good Samaritan Act. And if you are CPR certified, so I'm guessing some of you in this room probably are, you have to act if you see someone laying on the ground. You have to begin CPR even if they do not want you to, just because it's a liability issue. You have to do it. It's just Good Samaritan. And so, I forgot to click. But that's basically all about CPR. So, thank you.